Are you ready to pass the trauma nursing exam and become a certified nurse? TCRN practice questions include full explanations to help you pass your certification on the first try. Please leave your suggestions in the comments below so we can continue improving our course. We are not affiliated with any official testing board, and these are no leaked exam questions. However, they are carefully designed to match the official trauma nursing exam topics. Trauma nursing is all about thinking fast, acting quickly, and saving lives during emergencies. Every trauma patient must first go through the primary survey, also known as the ABCD approach. This method helps nurses find life-threatening problems in the correct order. A stands for airway. Always check if the airway is open and clear. If the patient cannot breathe properly, you must open the airway while protecting the neck and spine. B stands for breathing. Look at chest movement, listen to lung sounds, and check if the patient is getting enough oxygen. C stands for circulation. Check the pulse and blood pressure, and stop any major bleeding immediately. Severe blood loss can quickly lead to shock. D stands for disability. This means checking the patient's brain function, often using the Glasgow Coma Scale. E stands for exposure. Remove clothing to look for hidden injuries, but keep the patient warm to prevent hypothermia. Shock is a very important topic in trauma care. Hypovolemic shock happens when the patient loses too much blood. Cardiogenic shock occurs when the heart cannot pump effectively, often after chest trauma. Neurogenic shock is caused by spinal cord injuries, leading to dangerously low blood pressure and a slow heart rate. Early signs of shock include pale skin, confusion, weakness, and a rapid pulse. Head injuries are also common in trauma patients. A concussion is a mild brain injury that may cause dizziness or confusion. A subdural hematoma is bleeding under the skull that develops slowly. An epidural hematoma is more dangerous because it can worsen very quickly. Nurses must carefully monitor pupil size, consciousness, and changes in behavior. Understanding the mechanism of injury helps predict what internal injuries may exist. Blunt trauma can happen during falls or car accidents, while penetrating trauma includes knife or gunshot wounds. After the patient is stable, nurses perform the secondary survey. This is a complete head-to-toe assessment. You will gather medical history, check allergies, inspect the back and spine, and look for injuries that may have been missed earlier. Chest injuries can quickly become life-threatening. A tension pneumothorax happens when trapped air collapses the lung and pushes the heart aside. A hemothorax occurs when blood fills the chest cavity. Flail chest happens when multiple ribs break, causing abnormal chest movement and severe breathing difficulty. Abdominal injuries are dangerous because internal bleeding may not be visible. Liver and spleen are common organs that bleed after trauma. Nurses often assist with ultrasound exams to look for hidden bleeding. Burn injuries require special care. First-degree burns affect only the top skin layer. Second-degree burns cause blisters and severe pain. Third-degree burns damage deeper tissues and may destroy nerves completely. Burn patients need fluids quickly, infection prevention, and careful monitoring. Broken bones are another major trauma topic. Open fractures expose the bone through the skin and increase infection risk. Pelvic fractures are especially dangerous because they can cause massive internal bleeding. Nurses must check circulation and protect injured limbs with splints. Spinal cord injuries can lead to paralysis or breathing failure. Patients with suspected spine injuries must wear a cervical collar and be moved carefully using spinal precautions. trauma care is also different for children and older adults. Children lose heat and blood very quickly, while older adults may have fragile bones and take blood-thinning medications. Teamwork and communication are essential in every trauma room. Nurses must communicate clearly with doctors and other staff to keep patients safe and avoid mistakes. Now it is time to test your knowledge with practice questions. For the full trauma nursing practice test, check the link in the description below, and do not forget to subscribe for more exam practice videos and nursing study guides. 1. What is the very first step when you assess a brand new trauma patient today? You must check their airway right away to make sure they can breathe fine. The airway is the most important part, because a blocked airway kills the patient fastest. 2. Which type of shock happens the most when a patient gets a bad bleeding injury? Hypovolemic shock happens very often when the body loses a massive amount of red blood. You treat this shock by giving fluids and giving blood through a big vein fast. 3. What does the letter E stand for when we do the primary trauma survey today? It stands for exposure, which means you take off all their clothes to look closely. Removing their clothes helps you find hidden injuries, but you must keep them warm afterward. 4. How do you open the airway safely if the patient might have a broken neck? You must use the jaw thrust method to open the mouth without moving the neck. Moving the neck can hurt the spine, so keeping it totally still is a rule. 5. What happens to the heart rate when a patient is in early hypovolemic shock now? The heart beats a lot faster to push the remaining blood around the body better. A fast heart rate is an early sign that the patient is losing blood somewhere. 6. Why do we put a hard collar on a patient who fell from a high roof? We use it to protect their neck, just in case their spine bone is broken. A broken spine can cause total paralysis, so we keep the neck safe and straight. 7. What score is the worst score on the Glasgow Coma scale for a brain injury? A score of 3 is the worst, which means the patient is in a coma. We check their eyes and their talking to figure out how bad the brain hurts. 8. Which organ bleeds the most often when a patient gets hit hard in the belly? The spleen bleeds very easily because it sits right under the ribs on the left. You might notice a lot of pain, and their blood pressure will drop down fast. 9. What is a tension pneumothorax, and why is it a big emergency for our patient? Air gets trapped in the chest space and crushes the lungs and the heart completely. The doctor must put a needle in to let the bad air escape the chest. 10. What should you always do first if you see bright red blood squirting out fast? You must hold pressure on the cut to stop the heavy bleeding right away now. Direct pressure is the best way to keep the blood inside the body of the patient. 11. How can you tell if a burn is a full-thickness third-degree burn today? The skin looks white and dry, and the patient feels no pain in that spot. The burn goes very deep inside, and it completely destroys the tiny feeling nerves there. 12. Why do older adults bleed more when they get a small cut on their arm? They often take blood thinner pills, which stops the blood from making a hard clot. You must press on the cut longer to help the bleeding finally stop for them. 13. What is a big risk for children when they are resting in a cold room? Children lose body heat very quickly, so they get cold much faster than adults do. Being cold makes it hard for blood to clot, so we use warm fuzzy blankets. 14. How do you treat a broken arm that has a sharp bone poking right out? You must cover the dirty bone with a clean wet cloth to stop dangerous germs. An open bone can get infected fast, so we keep it clean and hold it still. 15. What causes neurogenic shock to happen in a patient who had a bad car crash? A high spinal cord injury causes it, making the blood vessels get very wide suddenly. The blood pressure drops very low, and their heart rate gets very slow and weak. 16. Why do we roll the trauma patient like a straight log onto their side together? We roll them to check their back, while keeping the whole spine safe and straight. We need many nurses to help roll, so we do not twist the broken spine. 17. What does it mean if a patient has unequal pupils when you shine a light? It usually means their brain is swelling from a bad hit to their hard head. A brain bleed pushes on the nerves, making one eye pupil get very big suddenly. 18. How do we guess the fluid needed for a patient with a very large burn? We use a special math formula based on their weight and the huge burn size. Giving enough fluids helps their kidneys work and keeps the patient from going into shock. 19. What is the secondary survey in trauma, and when do we start doing it exactly? It is a full body check, which we do after the absidy steps are done. We look for smaller hidden injuries and ask the patient about their past medical history. Section 2. Welcome back to Section 2, where we talk about head and neck injuries today. TCRN injuries are very scary because they can hurt the brain and the spine. We will learn how to check them and how to keep our patients safe. When a patient hits their head, the brain can bounce around inside the skull. This bouncing causes a lot of swelling, which pushes against the hard bone wall. We call this high pressure inside the head, increased intracranial pressure or ICP today. If the pressure gets too high, the brain loses its normal blood supply fast. You must watch the patient closely to see if they get sleepy or confused. A sleepy patient is a bad sign that the brain pressure is going up. We always keep the bed lifted up to help the blood drain down easily. You should keep their neck straight so the blood vessels stay wide and open. Do not let the patient cough hard, because coughing makes the head pressure worse. Let us talk about skull fractures, which happen when the head hits something hard. Abyssal skull fracture is at the bottom, near the base of the brain. You might see dark bruises around their eyes, which we call raccoon eyes now. You might also see clear fluid leaking out from their nose or their ears. This clear fluid is brain water, and it means the brain bag is torn. Never put a tube in their nose if you think the skull base broke. Next we will look at neck injuries, which can happen in a bad crash. The neck bones protect the spinal cord, which tells the body how to move. If the neck bones break apart, the spinal cord can get cut or crushed. You must keep the neck totally still until a doctor checks the bone pictures. We use a hard plastic collar to stop the neck from bending or twisting. Only a doctor can take the collar off after looking at the clear X-rays. Sometimes the airway gets blocked when the neck or the face is hurt badly. You might see broken teeth or blood stuck deep inside the mouth right now. We use a suction tube carefully to clean the mouth and help them breathe. If the patient cannot breathe well, the doctor will put a breathing tube in. We call this putting a tube in the windpipe, intubation for a sick patient. You must have all the tools ready before the doctor starts this fast process. After the breathing tube goes in, you must listen to both lungs right away. You should hear the air moving equally on the left and the right sides. We also use a special sticker to check if the tube is placed right. Pain control is still a big job, even if the patient is very sleepy. You must give them pain medicine to keep their heart rate and pressure low. Too much pain makes the brain swell, so we work hard to stop it. Family members are often very scared when they see their loved one hurt badly. You should explain things in simple words to help them feel a bit better. We answer all their questions nicely and give them a quiet place to sit. Now we will start the test questions to see how much you have learned. Read each question very carefully and try to guess the answer in your head. 20. What is a very bad early sign that the brain pressure is too high? The patient becomes very sleepy and confused when you try to talk to them. High pressure stops blood from reaching the brain, making the patient tired and confused fast. 21. Why do we keep the head of the bed lifted up for head trauma? Lifting the head helps the extra blood drain down, away from the swollen brain. Gravity pulls the blood down the neck veins, which lowers the pressure inside the head. 22. What are raccoon eyes a sign of in a patient with a head injury? Raccoon eyes show bruising around the eyes, meaning a broken base of the skull. A basilar skull fracture bleeds down into the soft tissue, causing dark purple eye bruises. 23. What is the clear fluid leaking from the nose after a bad head hit? The clear fluid is cerebrospinal fluid, which surrounds and protects the heavy human brain. A torn brain covering lets this special fluid leak out, creating a bad infection risk. 24. Why must we never put a tube in the nose with a basilar fracture? The tube could go straight up through the broken bone, into the soft brain. We always use the mouth for tubes instead, to keep the injured brain completely safe. 25. How do we keep the neck totally still before the doctor checks the X-rays? We place a hard plastic cervical collar tightly around the neck of the patient. The hard collar stops the patient from moving, which protects the broken spinal cord bones. 26. Who is the only person allowed to take the hard plastic neck collar off? Only a doctor can take the collar off after checking the bone pictures carefully. Removing the collar too early can cause paralysis if a broken bone shifts around suddenly. 27. What should you do if a patient has a lot of blood in their mouth? You must use a suction tool quickly to clean the blood out right away. Blood can block the airway fast, stopping the patient from getting enough oxygen to live. 28. What do we call the fast process of putting a breathing tube in the windpipe? We call this process intubation, and it helps the patient breathe air much better. A tube keeps the airway open and safe when the patient cannot breathe alone anymore. 29. How do you check if the breathing tube is in the right place initially? You must listen to both lungs with a stethoscope to hear the air move. Hearing equal breath sounds means the tube is safe and sitting inside the windpipe properly. 30. Why is coughing very bad for a patient who has a severe brain injury? Coughing makes the pressure inside the head spike, which hurts the swollen brain more. We give medicine to stop the hard coughing, to keep the head pressure very low. 31. What happens to the spinal cord if the neck bones break and shift apart? The soft spinal cord gets crushed or cut, which can stop the patient from moving. This injury stops messages from the brain, causing paralysis in the arms and the legs. 32. Why do we talk to the scared family, using very simple and clear words? Simple words help them understand what is happening, without making them feel more confused. Families are stressed during a trauma event, so clear talking helps them calm down faster. 33. What is the main reason we control pain for a patient with head trauma? We control their severe pain to keep the dangerous brain swelling from getting much worse. High pain causes stress and fast heart rates, which pushes more blood into the head. 34. How does keeping the neck perfectly straight help lower the pressure inside the head? A straight neck keeps the large neck veins open, letting the extra blood flow down. Twisted necks block the blood from leaving, making the brain swell up very fast indeed. 35. What is the first thing you need ready before the doctor starts the intubation? You must have the suction tool turned on and all the breathing tools completely ready. Being prepared saves time during the emergency, keeping the brain from losing its oxygen supply. 36. Why do we check a special color sticker after putting the breathing tube in? The sticker changes color to show carbon dioxide, proving the tube is in the lungs. This color change tells us right away that the tube did not go in the stomach. 37. What should you do if the patient becomes suddenly very sleepy after a head hit? You must call the doctor right away, because the brain pressure is getting too high. Sleepiness shows the brain is losing oxygen fast and needs a doctor to help quickly. 38. What is the very best way to keep an injured neck totally safe and still? You must leave the hard collar tightly on and never let them turn their head. The hard collar is the strongest tool to hold broken neck bones perfectly in place. Section 3. This is the section 3, where we will look at belly and pelvic injuries. These injuries are very tricky, because you cannot see the bleeding on the outside. We must look for signs of hidden blood and act fast to save them. When a patient hurts their belly, the spleen and liver break the most often. The spleen sits on the left side, under the lower ribs of the patient. If the left lower ribs break, they can easily poke and tear the spleen. A torn spleen bleeds a whole lot, causing the blood pressure to drop down. The liver is on the right side, and it is very large and heavy. A broken liver also bleeds heavily, filling the belly space with dark red blood. You must look at their stomach to see if it is getting very big. A hard and swollen stomach means that blood is pooling deep inside the belly. The doctor uses a fast ultrasound machine to look for this hidden internal bleeding. We call this the fast exam, and it saves many lives in the hospital. If the ultrasound shows a lot of blood, the patient goes to surgery fast. Now let us talk about pelvic bones, which make a ring around the hips. A broken pelvic ring is terrible, because big blood vessels run right behind it. When the ring breaks open wide, those big blood vessels tear and bleed fast. A patient can lose all their blood, right into their deep pelvic space today. You must wrap a tight sheet around their hips to close the broken ring. This tight wrap pushes the bones together and helps stop the massive fast bleeding. Never push down on a broken pelvis, because you can make the bleeding worse. You must also look for blood near the bottom area to check for tears. If there is blood down there, the tube for pee might be totally broken. You must never put a pee tube in until a doctor checks it safely. Pregnant trauma patients need special care, because we have 2 lives to save now. The baby sits inside the uterus, which gets very big as the baby grows. If the mother gets hit hard, the baby can get hurt or lose oxygen. We always roll pregnant mothers slightly onto their left side on the stretcher bed. Laying flat on their back is bad, because the baby squishes the big veins. Rolling them to the left side helps the blood return to the mother's heart. You must put a heart monitor on the belly to listen to the baby. A slow baby heart rate means the baby is in trouble and needs help. We also watch for fluid leaking, which means the water broke way too early. Now we will talk about the kidneys, which sit in the back of the belly. A hard hit to the lower back can easily bruise or cut a soft kidney. If the kidney is hurt badly, you will see red blood in their pee. We check their pee color closely to find out if the kidneys are safe. Always check their lower back for bruises and feel the bones for any pain. A broken backbone can hurt nerves, causing pain to shoot down the legs. We keep the back perfectly straight until we get pictures of all the bones. Pain medicine is a big help when dealing with all these very bad injuries. We give pain medicine through the vein, so it works fast and helps them. Let us move to the test questions to see what you remember from today. 39. Which organ is mostly injured when the left lower ribs break from a fall? The spleen is hurt the most, because it sits right under those left ribs. A broken rib bone pokes the spleen, causing a large amount of bleeding inside. 40. Why do we use a fast ultrasound machine on a badly hurt belly today? We use the ultrasound to look for any hidden blood pooling inside the belly. Finding blood fast helps the doctor decide if the patient needs quick surgery now. 41. What happens to the blood pressure when the liver gets cut and bleeds heavily? The blood pressure drops very low because the body loses so much red blood. The liver holds a massive amount of blood, so a cut causes fast shock. 42. What does a hard and swollen stomach mean after a very bad car crash? It usually means there is massive bleeding, filling up the space inside the belly. The blood has nowhere to go, so it stretches the stomach out very tight. 43. Why is a broken pelvic ring a very bad and dangerous injury for patients? Big blood vessels sit behind the pelvis, and they tear when the bones break. Torn pelvic vessels bleed very fast, causing the patient to lose all their blood. 44. What is the best way to help stop heavy bleeding from a broken pelvis? You must wrap a strong sheet very tightly around their hips to squeeze them. The tight wrap holds the bones closed, which pushes on the vessels to clot. 45. Why should you never push down on a pelvis that might be completely broken? Pushing down moves the broken bone pieces, which will make the deep bleeding worse. You must keep the bones totally still to stop the sharp edges from cutting. 46. What does blood near the pee hole mean when a patient breaks their pelvis? Blood there means the small pee tube might be cut or completely torn open. You must never insert a pee tube because it can poke outside the tear. 47. Why do we roll pregnant trauma patients slightly onto their left side in bed? Rolling to the left moves the heavy baby off the big mother blood vessels. This keeps the blood flowing well to both the sick mother and her baby. 48. What happens to the mother's blood flow if she lies flat on her back? The heavy baby squishes a big vein, which stops blood from returning to the heart. When the blood return stops completely, the mother and baby will both lose oxygen. 49. How do we check if the baby is safe after the mother is hurt? We place a special monitor on her belly to listen to the baby's heart. A normal baby heart rate means the baby is getting enough oxygen to live. 50. What does a very slow baby heart rate tell us about the baby inside? A slow heart rate is a warning that the baby is struggling for oxygen. The doctor must act very quickly to help save the baby from brain damage. 51. Which organ is most likely hurt if a patient takes a hard back hit? The soft kidneys sit in the back, so they bruise easily from hard hits. The kidneys filter our blood every day, and they sit right behind the belly. 52. What is the most common sign that the kidney is bleeding after a fall? You will clearly see bright red blood pooling down inside the patient's pee bag. Damaged kidneys let the blood mix with pee, turning the yellow liquid bright red. 53. Why do we keep the spine perfectly straight when checking for backbone injuries? Keeping it straight protects the nerves, so the patient does not become paralyzed today. Twisted backbones can pinch or cut nerves, stopping the legs from ever working. 54. How does severe belly pain change the way a trauma patient breathes in bed? The patient takes very short breaths because breathing deeply makes their injured belly hurt. Shallow breathing means they get less oxygen, which is very bad for healing tissues. 55. Why do we give strong pain medicine directly into the vein of the patient? Medicine in the vein works very fast and gives quick relief to the patient. Pills take too long to work, and sick patients cannot swallow pills safely anyway. 56. What does a positive fast exam mean for a patient with a belly injury? It means the ultrasound screen shows blood floating freely inside the deep belly space. A positive test is a red flag, meaning the patient needs an operation immediately. 57. Why do we always check the mother's belly for any clear fluid leaking out? Clear fluid means the baby's water bag broke open too early from the crash. Early water breaking raises infection risks and can cause the baby to come early. To get the full course today, please look in the description box below this video. Section 4. We are not affiliated with the official testing board in any way at all today. These are not leaked questions from the actual exam, but they are rigorously aligned with the official exam curriculum. Welcome back to Section 4, where we talk about chest injuries today. The chest holds your heart and lungs, which keep you alive every day. When a patient hurts their chest, they can stop breathing very fast. We must act quickly to make sure they get enough oxygen always. A broken rib is very common when someone hits their chest hard. Broken ribs hurt a lot, especially when the patient tries to breathe in. Because of this bad pain, the patient takes very shallow and short breaths. Shallow breathing is dangerous because it can lead to a bad lung infection. You must give them pain medicine so they can take deep breaths safely. Sometimes a piece of the chest wall breaks completely free from the ribs. We call this a flailed chest, and it makes breathing extremely hard today. The broken chest part moves in when the patient tries to breathe air in. This opposite movement means their lungs cannot fill up with enough good air. The doctor might need to put them on a breathing machine to help. Another bad chest injury is when a lung completely pops inside the chest. We call this a pneumothorax, and it traps air in the chest space. The trapped air pushes hard against the good lung and the beating heart. This pushing lowers the blood pressure and stops the heart from pumping well. A doctor must place a big tube into the side of the chest quickly. This chest tube lets the trapped air out and helps the lung open. Sometimes blood fills the chest space instead of just trapped air today. This bleeding inside the chest is called a hemothorax by the doctors. A chest tube is also needed to drain all this heavy dark blood. You must watch the drain carefully to see how much blood comes out. If too much blood drains out fast, the patient needs emergency chest surgery. Let us talk about the heart now, because chest hits can hurt it. A hard hit to the steering wheel can bruise the front of the heart. A bruised heart cannot pump blood well, causing the blood pressure to drop. We watch their heart rhythm closely to look for any dangerous beats. Another rare but scary problem is when blood fills the bag around the heart. We call this cardiac tamponade, and it squishes the heart muscle completely tight. The squished heart cannot fill with blood, so the patient will die fast. You might see their neck veins get very big and stick out fully. The doctor must poke a long needle into the chest to drain this fluid. You must have the needle tray ready to help the doctor work fast. Always keep the patient very calm while the doctor does this scary procedure. Good teamwork saves many lives. When chest injuries happen in the emergency room, you must talk clearly with everyone to make sure no steps are missed. Always check their breathing again after any chest tube or needle is placed. We do this to make absolutely sure that the patient is getting better. 58. What is the most common injury when a patient hits their chest hard? A broken rib is the most common injury from a hard chest hit. Broken ribs are very painful, and they make it hard for the patient to breathe deeply. 59. Why is shallow breathing very dangerous for a patient with broken chest ribs? Shallow breathing stops the lungs from opening, which can cause a bad infection. The correct way to prevent this infection is to give them strong pain medicine quickly. 60. What happens to the chest wall when a patient has a flailed chest? A piece of the chest wall breaks completely, moving in the wrong direction. This opposite movement stops the lungs from working, making it incredibly hard to breathe air. 61. How does a doctor fix a chest that has trapped air inside it? The doctor puts a large plastic tube into the side of the chest. This tube lets the bad air out, which allows the collapsed lung to open again. 62. What do we call the problem when blood fills up the chest space? We call this dark bleeding inside the chest a dangerous hemothorax right now. The correct treatment is a chest tube to drain all the heavy blood out fast. 63. When does a patient need emergency surgery for a bleeding chest injury today? Surgery is needed if the chest tube drains way too much blood quickly. A massive amount of blood means a very big blood vessel is completely cut open. 64. What part of the body hurts when the steering wheel hits the chest? The steering wheel can hit the heart hard, causing a very bad bruise. A bruised heart muscle is weak, and it cannot pump the red blood very well. 65. Why do we watch the heart rhythm for a patient with chest trauma? We look for any dangerous or strange beats caused by the heart bruise. These weird heart rhythms can kill the patient if we do not fix them fast. 66. What happens to the heart muscle during a severe cardiac tamponade emergency today? Blood fills the tight bag around the heart, squishing the muscle completely flat. This squishing stops the heart from filling, which drops the patient blood pressure down fast. 67. What happens to the neck veins when blood squishes the injured heart muscle? The large neck veins get very big, and they stick out completely full. The blood cannot enter the squished heart, so it backs up into the neck veins. 68. How does a doctor treat a patient who has blood squishing their heart? The doctor pokes a very long needle into the chest to drain fluid. Draining the tight blood bag is the correct way to let the heart beat properly. 69. Why must you keep the patient calm while the doctor pokes their chest? Staying calm keeps their heart rate low, which helps them survive the procedure. A fast heart rate makes the bleeding worse, so you must speak softly to them. 70. What is a tension pneumothorax, and why does it kill patients so fast? Trapped air pushes the heart and lungs, stopping the blood flow entirely now. This high air pressure is very dangerous, and requires a needle to escape the chest. 71. What should you always check again after a chest tube is placed inside? You must check their breathing sounds again to make sure both lungs work. Hearing equal air movement is the correct sign that the chest tube is helping them. 72. Why do broken ribs cause a drop in the total oxygen level today? The severe pain stops the patient entirely from taking any deep breaths in. Without taking big deep breaths daily, the patient gets much less oxygen in their blood. 73. What is the very first thing you must do for bad chest pain? You must check their airway and breathing to ensure they get oxygen fast. Giving oxygen is always the best first step to help an injured heart and lungs. 74. What kind of sound do you hear if air is trapped in the chest? You will hear no breath sounds at all on the injured chest side. Trapped air crushes the soft lung tissue, so the air cannot move inside at all. 75. How do you prepare the room for an emergency chest tube insertion procedure? You must open the clean tube tray and get the suction machine ready. Being fully prepared helps the busy doctor insert the chest tube much faster for safety. 76. Why is teamwork so incredibly important when managing a bad chest trauma emergency? Teamwork ensures that every person knows exactly what step they must do next. Clear talking stops dangerous mistakes, keeping the sick patient perfectly safe during the busy rush. To get the full course today, please look in the description box below this video. Section 5, our arms and our legs can get hurt very badly in terrible crashes. A broken bone is called a serious fracture, and it hurts a lot. When a sharp bone breaks through the skin, it is an open fracture. You must cover the exposed open bone with a very clean wet bandage. This keeps the dirty, dangerous germs away to stop a very bad infection. We use a very strong, firm splint to keep the broken arm completely still. A tight splint stops the sharp bone from cutting the soft nerves and vessels. Always check the weak pulses in their feet after you put a firm splint. If you cannot feel a bounding pulse, the tight splint might need adjusting soon. Let us talk about dangerous compartment syndrome, which is a very scary medical emergency. This happens when fluid swelling gets trapped inside the tight leg muscle space today. The very high muscle pressure cuts off blood flow to the foot or hand. The patient will cry loudly from extreme pain, even after you give pain medicine. The sharp pain is incredibly much worse when you try to stretch their fingers. The surgeon doctor must cut the skin open to let the tight muscle swell. This deep cutting surgery completely saves the leg from dying entirely without blood flow. Severe crush injuries happen when a heavy rock falls directly on a patient leg. The heavy crushing weight destroys the soft muscles, which releases a dangerous bad chemical. This dangerous bad chemical travels to the kidneys and completely blocks them up fast. You will see their daily pee color turn into a very dark red-brown. You must give them plenty of clear water through the arm vein very quickly. Lots of clean water flushes the sick kidneys to keep them working well today. Sometimes a very bad car crash can cut off a whole arm or hand. We call this a complete traumatic amputation, and it bleeds a very massive amount. You must put a very tight thick tourniquet high up on the actively bleeding arm. Twist the tight tourniquet very strongly indeed, until the bright red bleeding completely stops. Wrap the severed cut body part safely in a slightly wet and clean towel. Put the cleanly wrapped part in a plastic bag and put that bag on ice. Never put the raw exposed body part straight onto the freezing cold hard ice. Direct ice completely burns the soft human tissues, making it impossible to attach again. Fat embolism is another very huge big danger when large leg bones break suddenly. Yellow bone fat leaks from the broken femur bone and travels to the soft lungs. This blocks the fresh red blood flow entirely, making it incredibly hard to breathe air. You might see tiny bright red blood dots on the upper chest or the neck. These tiny bright red dots are a warning sign that yellow fat is in the blood. You must sit the struggling patient upright and give them pure oxygen very fast. Always move completely broken legs very extremely slowly to stop the fat from moving. Painful joint dislocations happen when a hard bone pops entirely out of its normal socket. This hurts a whole absolute huge lot, and the bent arm will look very weird. A strong doctor will pull the bone back firmly into the proper normal right place. We give medicine to make them very sleepy safely, so it does not hurt them. After the huge bone goes safely back in, you must check the pulse once again. If the strong pulse is perfectly beating well, the arm is getting enough red blood. We wrap the injured joint with clean bandages safely to keep it still for healing. Always tell the hurt patient how to care safely for their newly fixed arm today. Good daily nursing care helps them heal extremely fast and walk completely normally again soon. Now we will move on to the questions, so you can test what you learned. What is the biggest danger when a heavy bone breaks through the skin? The open wound lets bad germs inside, causing a very terrible infection. We must cover the dirty bone quickly with a clean and wet towel. This is the correct way always to keep dangerous germs completely away today. Why do we always use a splint to hold a broken arm perfectly still? A rigid splint stops the sharp broken bone from cutting any blood vessels. Keeping the bone completely still is the correct method to save their tiny nerves. What should you always check right after placing a splint on a patient leg? You must always check the foot pulse to ensure blood is flowing very well. A missing pulse means the splint is too tight, which is the correct sign. You must fix the tight splint to save their foot from dying completely. Why is compartment syndrome considered a very scary emergency for our trauma patients today? High pressure trapped inside the tight muscle completely cuts off the fresh blood supply. The correct treatment is fast surgery right away, to cut the tight skin open. How does a patient act when they have terrible compartment syndrome pain right now? They cry loudly because the terrible pain does not get better with strong medicine. The correct clue is extreme pain when stretching, because the trapped muscle is dying. What bad chemical leaks into the blood when a heavy rock crushes their muscles? A bad muscle chemical leaks out fast and completely blocks the working human kidneys. This blocks the kidney tubes tightly, so the correct fix is flushing with water. What color does the pee become when a patient has a severe crush injury? The patient pee turns dark red or brown because the kidneys are badly blocked. Dark brown pee is the correct warning that chemicals are destroying the tiny filters. How do we fix the blocked kidneys caused by a very heavy crush injury? We give a huge amount of clear fluids directly into their arm vein quickly. The correct way to save them is flushing, which washes bad chemicals completely away. What is the very first thing you must do for a completely severed arm? You must place a very tight tourniquet high up above the actively bleeding cut. A tight tourniquet is the correct tool used to stop massive bleeding completely today. How tight should you twist the tourniquet on a badly bleeding arm right now? You must twist it very tightly indeed, until the bright red bleeding completely stops. Stopping the blood flow is the correct goal, even if twisting the band hurts. How should you store a cut body part to keep it completely safe forever? Wrap it cleanly in a wet towel and place it safely inside a bag. The correct way is putting that bag on ice, avoiding direct contact with ice. Why must you never place a severed finger directly onto freezing cold solid ice? Direct ice freezes the soft tissues entirely, completely destroying the tiny blood vessels inside. Destroyed vessels mean the doctor cannot attach it, so wrapping is the correct rule. What is a fat embolism, and why does it happen after major bone breaks? Yellow fat from the big broken bone travels extremely fast into the soft lungs. This is a deadly lung problem today, and the correct sign is breathing trouble. What tiny skin marks show up clearly when a patient has a fat embolism? You will see tiny red dots appear suddenly on the upper chest and neck. These red dots are the correct warning today that dangerous fat is floating inside. How do you stop fat from moving freely when a large leg bone breaks? You must keep the broken leg totally still and move the patient very slowly. Keeping the leg still is the correct method to trap fat inside the bone. What happens to a body joint when the bone pops out of the socket? The joint looks very weird and bent out, and it hurts the patient immensely. This is called a painful dislocation today, and the correct fix is pulling it. Why do we give sleepy medicine before fixing a badly popped out joint today? The medicine relaxes the tight pulling muscles entirely, making the pulling procedure hurt less. Relaxed muscles are the correct safe way to let the heavy bone slide back. What must you check immediately after the doctor fixes a dislocated arm joint completely? You must feel carefully for a strong pulse right below the newly fixed joint. A strong bounding pulse is the correct sign that the blood vessels are safe. Why is good nursing care important always after wrapping a newly fixed arm joint? Good daily care helps the injured joint heal quickly so they can walk again. Teaching the patient is the correct daily step to make sure they heal perfectly. Section 6. When a patient loses blood, we must replace it to save their life fast. Giving blood is very serious, and you must check the patient blood type carefully. If you give the wrong blood, the patient can have a deadly bad reaction. You will see them shaking, and their back will start to hurt a lot. You must stop the blood immediately and tell the doctor about the bad reaction. We give special O-negative blood when we do not know their blood type. This type of red blood is very safe for everyone in a huge emergency. Let us talk about cold weather, which causes a dangerous problem called severe hypothermia. Hypothermia happens very fast indeed when a person falls into freezing cold deep water. Their body temperature drops low, making their heart beat very slow and extremely weak. A cold heart is irritable, and it can completely stop beating if bumped hard. You must handle cold patients carefully to keep their sick heart perfectly safe always. We warm them up slowly, using heated blankets and warm fluids in their veins. Never rub their freezing cold arms, because rubbing pushes very cold blood back inside. Cold blood hitting the heart can make the heart stop pumping red blood completely. Heat stroke is another bad emergency, caused by spending hours in the hot summer sun. The body completely loses its ability to cool down by sweating clear water outside. The skin gets very hot, and it will look totally red and extremely dry. They will act very confused, and might even have a bad seizure right away. You must cool them down fast, using wet ice packs on their hot neck. We also spray them with water, and put a big fan beside their bed. Always check their blood sugar, because hot bodies use up all their energy fast. Lightning strikes are very scary, because they send huge electricity right through the body. The electricity stops the human heart, and completely paralyzes the breathing muscles right away. You must do chest compressions immediately, to keep the blood flowing to their brain. Lightning leaves a funny burn mark, that looks just like a tiny red tree. The huge electric shock inside can also break bones by pulling muscles too hard. Drowning is a terrible lung trauma, especially for young children near a deep pool. Water fills the soft pink lungs, making it absolutely impossible to breathe good air. You must give them oxygen quickly, to push the dirty water out of lungs. Always check their neck bones safely, because they might have jumped into shallow water. We keep them in the hospital, to watch for late lung infections and swelling. Let us talk about animal bites, which can bring very bad sicknesses into humans. Dog bites cause tearing skin wounds, and they have lots of dirty germs inside. You must wash the bite completely, using plenty of clean water and good soap. We often leave bite wounds open, so the dangerous trapped germs can drain out. Closing a dirty bite wound tightly can easily cause a huge and bad infection. Snake bites are completely different, because they inject bad venom into the human leg. The poison breaks the blood vessels, causing massive swelling and very bad bleeding soon. You must keep the patient calm, and hold the bitten leg lower than heart. Never suck the poison out yourself, and never put cold ice on the bite. We give special antivenom medicine quickly, to completely stop the poison from working today. This is the final section today, to help you pass the trauma nurse test. We covered many huge important topics, to prepare you for the busy hospital emergency. Remember to always check the airway, and look for any massive bleeding right away. Good trauma nurses stay very calm, even when the emergency room gets incredibly crazy. You will do a great job, if you always follow the primary survey steps. Your patients will thank you forever, for saving their lives when they needed help. I am very incredibly proud of all the hard studying you have done today. Review these practice questions again totally, until you know all the answers perfectly well. 96. What is the very first step, if a patient gets a wrong blood type? You must stop the blood flowing, and tell the doctor about it right away. The wrong blood makes them shake, and it is the correct way to save them. 97. What type of safe blood do we give during a massive unknown trauma emergency? We always give them O negative, because it is extremely safe for every patient. This safe blood matches everyone well, which is the correct choice in a fast rush. 98. Why must we never rub the freezing cold arms of a hypothermia trauma patient? Rubbing pushes freezing cold blood inside, which can completely stop the heart from beating. The cold blood shocks the heart, making it stop working in the correct rhythm completely. 99. What does the skin feel like when a sick patient has a heat stroke? Their skin feels incredibly hot, and it will be totally red and completely dry. They stop sweating completely today, which is the correct sign that they are dying fast. 100. How do you lower the temperature for a patient with a dangerous heat stroke? You must use wet cold ice packs and put a big fan beside them. Cooling them fast is the correct method to save their hot brain from severe swelling. 101. Why must you do chest compressions right after a huge bad lightning strike event? Huge electricity stops the heart entirely, so compressions keep the brain alive right now. Doing compressions is the correct way to pump the blood when the heart fails completely. 102. What kind of funny skin mark does a lightning strike leave on the body? It leaves a dark red burn that looks exactly like a tiny little tree. The huge electric shock causes this, which is the correct visual sign of the strike. 103. Why do we always check neck bones when a person drowns in a deep pool? They might have hit their head on the very hard and shallow pool floor. Checking the neck is the correct action to stop them from becoming completely paralyzed today. 104. How should you clean a dog bite to prevent a huge and bad infection? You must wash the open wound using plenty of clear water and good soap. Washing away dirty animal germs completely is the correct way to keep the patient safe. 105. Why do we usually leave dirty animal bite wounds completely open to heal alone? Leaving them open lets the bad germs totally drain out of the deep wound. The correct reason for not sewing is to stop trapped germs from getting much worse. 106. What does bad snake venom do to the tiny blood vessels in the human leg? The bad venom breaks the vessels, causing very heavy bleeding and a huge swelling. Giving the special antivenom medicine fast is the correct way to fix this poison problem. 107. Why must you never suck snake poison directly out with your own human mouth? The dangerous poison can easily enter right into your own body through your gums. The correct rule is staying safe and bringing the sick patient to the hospital fast. 108. What should you always check if a hot heat stroke patient acts very confused? You must check their blood sugar because their hot body uses energy very fast.